the world. Okay. In fact, he also makes this claim that, in the world order that we presently are in, the chances of people dying out of obesity is actually way more than people dying because of lack of food. Now, all those assumptions suddenly, which made a lot of sense some 3-4 months back, seem to have turned upside down. Okay. And this crisis I have felt, and in fact, several people have felt, it has completely, and fundamentally altered our knowledge or our understanding of what we thought we knew. Okay. And very, very seriously demonstrating the gaps in our understanding, the limits to our knowledge, and indeed limits to any kinds of scientific understanding of the world. We go to the next slide, please. The scientific knowledge is something which has been scrutinized for a long time by those who are in social sciences. If you look at Michel Foucault and his very influential work, The Birth of the Clinic, way back in 1963, he spoke about what is known as a medical gaze. What is this medical gaze? It is how a doctor or a medical practitioner looks at a body. Okay, so it is not a human being that you're looking at. You're looking at a set of symptoms. You're looking at certain body types, some body parts. Okay, and making assumptions about and making very important decisions that are going to that could be in fact life altering for the person at the receiving end. Okay, so human beings are then a sum total of the symptoms. Okay, and kind of alienated from this whole idea of a being, of their humanness. Okay, and when you import that understanding of the medical gaze now, you will see how much it makes sense for the way we are treating COVID positive people. Okay, they're separated from their families, they're put in containment areas, you're not allowed to see them. Even after their death, it is a struggle to get to see your loved ones. Okay, now this kind of an insight of what a very regimental medical system can do to you in connivance with the state is something that the social sciences offers one to understand. And therefore, I think it is extremely important to bring it back in to our knowledge systems to make sense of the new world order that we are in. Indeed, for all our scientific advancement, the scientific community is struggling now with COVID-19. Whether it's a cure, whether it's a vaccine, we really don't know where we are. Okay, and the timelines actually are not very encouraging. Okay, we also know that in the last few months, just think about the number of graphs that you have seen. Okay, you must have seen at least hundreds of graphs, different kind of predictive modelings, different kinds of mathematical modelings of where we are going, where we are likely to be in 7 days, 10 days, 1 month, 2 months. Okay, and now we also know that several of this got it all wrong. Okay, there have been underestimations, there have been overestimations, and a lot of gadbad in between. Okay, now what can we just move to the next slide, please, Mr. Thomas? So this actually brings us to understand that there is a limit to scientific knowledge, there is limit to science. Okay, and that there are a large number of uncertainties which are associated with the disease, with the pandemic, and also with the way we are dealing with it. Okay, the question also becomes important to ask is that are the sciences open to embrace and acknowledge these uncertainties? Okay, and one of the reasons why possibly we have so much of uncertainties or why we have some problems is that when we are thinking about these models, we are mainly predominantly accounting for biological factors. Okay, we're dealing with statistics. At best, we are dealing with population sciences. Okay, it is perhaps a little important that these models were better informed by social sciences perspective. Perhaps if they had done it, they could be more sensitive in terms of responding to the emerging situation. Look at the migrant issue, for example. We often find ourselves saying, oh, well, it was unanticipated. Nobody expected that, thousands of migrants would, start suddenly, move out of their houses and start walking thousands of kilometers. Who could have anticipated that? Well, there have been volumes written about migration, volumes literally, okay, by economists, by sociologists, by public policy experts. If only we had actually, integrated the knowledge system, the science and the social sciences together, perhaps we would have been a little more prepared. We would have known what to expect, you know. So in such circumstances, it is important to ask, what does social science have to offer? Okay, the most important thing I think social sciences offer is a lens through which you look at the problem. Okay, and what does that lens offer? Maybe we go to the previous slide. We are not done yet with the previous slide. So social sciences offer this lens that enables the policymaker to acknowledge that the needs of the people are as heterogeneous, as diverse as the population of India, okay, or for that matter, the population of the world. Okay, it is the same pandemic perhaps, but it has a very different impact on the different population sets. Okay, the way a middle class person experiences it is very different from the way an upper middle class person, a rich person, or a poor person would acknowledge, would experience it. And it is this differentiated need that needs to be accounted for. Even now we go to the next slide. Yeah, here, yeah, we stay here for some more time. No problem, no problem. Yeah. So, we talk about the migrant problem, for example. But what comes to the mind when we talk about the migrants? We have an imagination of the migrants, right? These are usually men walking on the streets, sometimes with their families. Okay. But we do not really think, for example, about women migrants to the city, especially women migrants who are working, as domestic helps in houses, single women migrants who are working in the so-called beauty parlors. Okay, though despite the fact that they make a sizable chunk of the migrant population. Okay, so this is a set which is invisible. Okay, it is invisible to the media. It is invisible to the popular understanding of the phenomena of migration. Okay, now social science helps us to make these visible. Okay, we talk about their aspirations. We talk about how migration for women, for young single women, opens up a world of freedom, a world of opportunity. And then we also ask, freedom is not just for exploring the city, right? It is also the freedom to return home when they wish to. Okay, and these are some of the questions that need to be asked, and which a social science background helps one to ask. Then you look at this very contentious issues about who do you allow to die in this crisis. Okay, you must have heard that, oh well, this particular COVID-19, it affects the elderly disproportionately. So if there are comorbidities such as diabetes, hypertension, the likelihood is more. So the young people need not worry so much. It is mainly the elderly who are likely to really be in a critical situation or even pass away due to this. Now, are we well within our ethical boundaries when we say that, okay, the young can live and the lives of the older generation is not so important? Okay, these are important questions to ask. Look at what is happening in the US. You must have seen day before yesterday, there was New York Times headlines, was not a headline. It actually had names of 100,000 people, 1 lakh people, saying that this 1 lakh is not a figure. This 1 lakh are human beings, They are people, right? Point one, point well taken. What we need to understand beyond the numbers are that who are the people who are dying in the US? The African Americans, who are usually overrepresented among those dead. Okay. And what is the proportion? On an average, for every white American who is dying, there are 3 African Americans who are dying. If you go to certain suburbs, if you go to some states which are, which have higher number of African American population, this ratio can go as much as 1:7, which means for every white person who dies, there are 7 African Americans who are losing their life to this. Okay. Now, what am I doing when I'm saying these things? I am making certain patterns a little more visible. Okay. I am making it a more complicated, a more complex thing to understand than what the numbers enable us to understand. It's not just any number. There are some people who are affected way more than the others. So in doing this, what I'm basically doing is that I'm exposing, or social sciences enables us, gives us the tools to expose the societal fault lines, because the social scientist talks about inequality. It talks about differential access to services, be it health services or any other kind, educational services. It talks about public policies that are found to be sometimes apathetic to the needs of the vulnerable. This is what social sciences offer. Go to the next slide, please. The other thing, so the social science, basically what it does, it helps to amplify the voices of the marginalized, the poor, the women, those belonging to LGBTQ communities, and the intersectionalities between them, in the sense that if I am a woman, I am likely to experience the COVID situation a little differently from a person who's a man, right? Then, if I am a woman from a poor background, I might my vulnerabilities are actually exacerbated. Now, think about me as a poor woman who is also a person with disability and who also lives in a crowded slum. Then you have a very complex situation, and it is this intersectional lens that makes it really important for the public policy makers to understand that a strategy that will perhaps work with the general population will not work for me, or at least one has to be a little more sensitive to understand that there are people like me who need support, right? Say, for example, the lockdown. Okay, a lot has been spoken about the lockdown, and we have spoken about the inevitability of the lockdown at that point of time. While acknowledging the inevitability of the lockdown at that point of time, we could possibly also understand that even the lockdown has been experienced very differently. Okay, and what could have possibly saved so much of uncertainty and so much of suffering was a degree of preparedness, a degree of accountability. Okay, so people have, we now talk so much about the plight of the migrant population. We also know that a large number of civil society organizations have reached out. People have pooled their resources, their feeding and all of that. But none of this is freebies. All of these have to be understood within a framework of social justice and rights of the people. You are not really doing anything, you're not really doing a charity. So what you're actually doing is that the state and the society has this obligation to feed the people who have been rendered without work under the circumstances. And you are just responding to that responsibility of yours. Okay, nothing more than that. Okay, now this is something that a social science perspectives enables one to understand. You're not doing a charity by feeding the people. You're not doing a charity by providing rations. In fact, you have made a mistake that you have not made your public distribution system portable. Okay, a greater social science infusion or integration into public policy would have meant that before the crisis would have happened, or when the lockdown was announced, what would have come, as a parcel of it was speediness, portability. Okay, these are certain things that enable even the COVID-19 situation to be dealt with a certain degree of sensitivity. We need to understand one thing. We need to understand how the society functions a little better. And in doing that, social sciences offer some kind of signposts. What are these signposts? There are certain key takeaways, from the entire thing. There's this very famous sociologist, Emile Durkheim, a French sociologist, who had this, who had offered this understanding of a concept called anomy. So what he had said is that society works because there is consensus among individuals and groups. Okay, there's some kind of a consensus that people reach about their roles and responsibilities, in the society. Okay, now this consensus can be precarious. This consensus can be skewed. They can be, skewed in terms of balance of power. Think of a construction site, for example. There are construction workers, and then there are mid-level officials, and then there are owners of these construction sites. There is no comparison in terms of the balance of power between all these parties, right? But at the same time, each of these groups have accepted their roles, okay, and some kind of an equilibrium is maintained there. Okay, and indeed the entire society, okay, society runs, and the society is held together by this equilibrium. What COVID-19 has done is that it has actually disrupted this equilibrium. It has actually, it has actually, there's a massive blow to this equilibrium, which was already precarious. Okay, so we are actually heading towards a state of anomy. Anomy meaning normlessness, anarchy. Okay, a state where the earlier rules by which, which were acceptable to the people, by which people went, the idea rules of authority, the earlier rules, the earlier norms, they are no longer accepted to all concerned, because they're seen as not benefiting them at all. Okay, and how does it manifest? What do people do when they realize that these rules do not really work any longer? They manifest in violence. Okay, you must have seen images of people getting down from the trains, the migrant trains, and ransacking certain stalls and taking up water bottles and potato chips. They're not thieves. Okay, they are hardworking people who are now put in a train without food or water. People are starving to death, right? And therefore, their sense of propriety that tells them that it is not a good idea to attack a stall and take away all the food can no longer be adhered to in the present circumstances. Okay, you must have also seen video footages of violence against police. Okay, police who are trying to ensure enforcement of lockdown, because the stakes are very different now. People are attacking public property. Several people have committed suicide, which means they have inflicted self-harm on themselves. Okay, what do these all things point out to? These point out to a certain kind of metamorphosis that is happening in the society. And therefore, it is important to bring in those skills that helps you understand what is going on here. Okay, and it cannot be commonsensical. Okay, commonsensical knowledge will tell you a lot of things, but those are just opinion. When you do social sciences, you actually put in some kind of a scientific rigor into an understanding of a society. Okay, and it is with this rigor that you actually bring in evidence, you bring in experience, you bring in history, you bring in statistics, you bring in economics, and understanding of politics. All of this taken together gives you a robust understanding of how the society is likely to respond to a particular crisis, which I think is extremely critical at this point of time. Can we move to the next slide, please? The next slide, please. Yeah. So, perhaps that takes us to the last slide of mine, which talks about what is the future of, of disciplines, of indeed any kind of education. See, indeed, the disciplinary boundaries, I'm sorry, it's not countries, it is boundaries. The disciplinary boundaries have been crumbling for some time. There is much greater uptake for interdisciplinary courses. Okay. We are now moving a little away from, doing master's degree or bachelor's degree in any one subject. UGC has recently said that you can do dual degrees. This is because responding to a need to to assimilate different kinds of knowledge together. Okay, so even before the COVID situation, actually it was being felt that we have actually as a society produced very good doctors, very good engineers. There is a fascination with the jobs or the employment in these sectors. But right now, what we need in the society as a whole, and much more so in the COVID situation, is empaths. Okay, we need storytellers, we need peacemakers, right? And there is a way to do that. Okay, people do not become storytellers and peacemakers just like that. Yes, there has to be a certain degree of interest, but at the same time, there is a scientific disciplinary orientation to it that enables people to be a better empath, a better storyteller, and a better peacemaker. Okay, and that, I think, is that we need the need for that is very much there, and more than ever right now. With that, I would like to thank the organizers for inviting me for this webinar, and I'm happy to take any questions. Thank you.
Thank you, Ipshita ma'am. Before the question answers, I would actually want to introduce some of the courses which has been offered by our Faculty of Sustainability Studies. And before moving on to the next presentation, I would have to inform students interested. We at Faculty of Sustainability Studies offer bachelor's in social sciences, and their master program like public health, ecology, environment and sustainability studies, agribusiness and management, sustainable rural development and sustainable inclusive development. Now over to I would also show the Ipshita ma'am.
Yes, I'm there.
Ma'am, can I show my presentation now?
Yes, absolutely. Please go ahead.
Yeah. Meena, you want to ask something, or Dr. Meena want to ask some question?
Okay, sure. Yes.
First of all,
Yeah, go ahead,
thank
please.
you very much, Ms. Ipsita Sapra.
Dr. Meena, please go ahead.
Hello. Can you hear me? Can you hear me?
Yes.
Yes, ma'am.
Yes, please.
Well, I would like to thank Ms. Ipsita for the wonderful presentation. It's a new way of looking at COVID. Like you rightly said, everybody is talking about clinical and so many papers and so much information. So this was such a fresh way of bringing that the major problem that we are having right now. Considering the social background, socioeconomic problems that we are currently facing, specifically in India. And I just wanted to ask this question is that when you mentioned the women aspect you talked about the poor and with disability. I also wanted to highlight about the women, elderly women, older women, which, in our society are actually the caregivers. They are not given care many times, but if they are even slightly healthier, they are the ones who are looking after the children. They have become the backbone. They are cooking, they are doing everything. And so when we are talking about ethical issues and we're talking about all the LGBT, BTQ and all, I think this is one area that I'm very interested that should also be highlighted, because we are in a society where there are many different countries where, okay, older people live alone, and or it's not such a I'm not talking about joint family, but really it's very close, the grandparents and especially the woman, and it's expected of this, the grandmother or the older person, to just take care. It's not even asked, nobody asked that question. But how do we then address that, and should we be addressing this by itself as a very, very important area which I am interested? Thank you.
Thank you for raising a very important question. Indeed, even when I was speaking about gender, I was speaking about intersectionality. I mean, it is not even sufficient to say women. One has to see, adolescent girls, for example, have very different needs, and the elderly women would have another completely different set of needs. And I would think that this intersectional lens is absolutely necessary in order to have a policy response which is sensitive to understand what in what ways a particular the COVID management can be actually thought about. Indeed, just yesterday I was listening to a webinar by Professor Veena Das, and she was talking about the South Korean experiences, where South Korean experience of managing COVID-19 is being shown as a gold standard. Now that has happened without too many lockdowns, and it has been possible because of contact tracing, which they have apparently done very well. Now the thing with that is that South Korea apparently has a very high percentage of single elderly persons. Okay, and now this contact tracing is not something that they have done today. This contact tracing is something they have done over a quarter of a century, for the last 25 years. And the level of contact tracing is that, especially the elderly people, they are entitled to state benefits if and only if they are able to demonstrate that they do not have any other source of sustenance. Okay, so if they would actually make a phone call and tell you that, madam, we have been following your phone call records. It seems that you regularly receive phone calls from this particular number. Okay, and from the name, it appears that this person is possibly your son or daughter. So maybe you are no longer entitled to the state benefits because, as per our records, you're already taken care of. Okay, so this works in multiple ways, right? So yes, intersectionality is important. Yes, we must steer gaze towards these pockets that we do not often acknowledge or often and I think the role of social sciences is to make these pockets very, very visible.
Thank you.
Is there any more questions?
Yeah, I would like to pose a question.
Yes, please.
Yeah, I predominantly work on providing access to healthcare, especially in the rural areas, by enabling technology. So what do you think now? There's so much talk about telemedicine being going to be the mainstay in terms of healthcare delivery. What do you think? Because there won't be any personal contact from the doctor. Everything will be done through a video call.
Yeah, thank you very much for your question. So now this whole thing about telemedicine and it's okay. It has gained a new meaning now But even before that, we had the Watson, and we had a whole set of, AI, artificial intelligence, intelligence inputs that went into this kind of, and this forms of, treatment. Now, I would think in a way it is positive, because I think, especially in the rural healthcare, it is important to ensure that the safety of the drugs that are administered is taken into account. Because we often do have a paucity of trained healthcare professionals, especially in the rural areas. You would see the If you see the numbers of trained professional health service providers is much less, and in such circumstances, it is and the numbers are very high. And so in under such circumstances, it would an IT or AI enabled health service delivery would be of help. Having said that, it is important to go back to what I said. We also need empathy and compassion in our society. Okay. Plus, the other thing that we need is accountability. Okay, at different levels of service, public service. The ways in which we create a more compassionate and sensitive society, especially for the poor, especially
clear-cut guidelines, especially Minister of Health and Family Welfare has come very clear guidelines about telemedicine, how it has to be administered. My question was basically, is it going to be accepted in the society? Is a big question that everybody has now. So probably we don't answer right away, but then all the other things are taken.
May I just attempt an answer, because it is a very important thing that you have asked. So some of my students had undertaken this project of understanding M-Health, mobile health practices in Mandla, which is a Naxal affected part of Madhya Pradesh. And the whole idea was to see that whether, you could use M-Health or this mobile health to provide antenatal services to women, pregnant women. So
Yes.
what is that, it was, there were certain questions which were there, and updates would be sent to women, and, they would be reminded about their health checkups, timing, and, that they have to undergo certain tests and all. So after doing it for a few months, they wanted to do an evaluation. And when they did the evaluation, there were certain startling, findings from that evaluation. One was that they required a smartphone, which a lot of women did not have. Okay. And even when there were smartphones, they were usually used by the husbands. So women had access to phones which were handed down to them. Okay. And the smartphones would be taken away by the husbands when they went to work. Okay. A. B. Information about pregnancy and childbirth was considered to be a very private information, and not something that people were very comfortable talking about, or in a very non-personalized medium. Okay, it was one thing to go to a gynecologist, or even or opening up to an ASHA worker or an Anganwadi worker. Quite a different thing to receive an animated voice, and you fill in some information there, even if it is a yes or no, that kind of a thing. Okay, so that felt, there was a gender issue that was coming there, which said that, they did not really feel too good about it. And third, and most interestingly, was that a lot of women themselves said that, what kind of women actually use smartphones, you see. Okay, so a moral woman, okay, would not really need a smartphone, because smartphones are actually morally corrupt.
Okay.
So, these are certain dimensions which one also has to take into account when you are thinking about acceptance of technology.
Yeah, I think I have a lot of work I have done from past 2.5 years in Southeast Asia, South Asia. Okay, probably I would like to collaborate and see, because as my understanding goes now, very clearly it's understood with the advent of 5G technology, 5G internet, that the telemedicine is going to stay, and the government is also very clear about these guidelines, because none of the doctors want to practice in the village, because they all want to practice in major cities. Okay, so there are a lot of issues around it. So probably I'll write a probably a descriptive email with my findings. I think that will be very interesting to collaborate and work.
In fact, this question is a very, it's actually a current contemporary question, especially in this current scenario, wherein people are forced to like keep the social distancing and physical distance, and with the fear and of catching COVID-19. And there's also one more problem when you go with the telephone telemedicine.
Telemedicine.
The thing is that this person who's actually having some kind of an access need not be the personal smartphone, maybe their own husband, anybody else in the family, but they should also be knowing how to use a smartphone, because at times there is one thing that is literacy, another one is also there, which is digital literacy. These two should come together for a person to be enabled and make them capable enough to use a telemedicines. And Another thing, as Ipshita ma'am has actually pointed out, it's also about the norms, about how well it is accepted by the family members or the person who's concerned wanting to have some kind of informations from the doctors. So all these information and circumstances should be taken into account when we are promoting telemedicines. And thank you,
Yeah.
ma'am and Darshan.
I just wanted to add few. Meena, you want to say something?
Very quickly, that the previous speaker, Mr. Darsanam, just mentioned about the telemedicine, and M-Health was also talked from Ms. Kiran. I think Dr. Joe Thomas could take this as a director of this area, public health, that we could have another kind of a webinar, or let's say collaborations, which I would be very interested, because I'm more interested, being from my former WHO work, that in the elderly population, and how can we bring the digital literacy. That is my very important, because I've seen it in with personal experience, and I think it can be done. And so it could be a great collaboration. Thank you.
Yeah, and thank you very much. Let me acknowledge the presence of Dr. Meena Cherian. Are you speaking from Geneva right now? You are joining with us from Geneva,
I
right?
live here. Yeah, I live
Okay.
here as usual.
So she was heading the emergency surgery program in WHO. So I'm very delighted, and thank you for being with us. I just wanted to add a few points. I'm sorry, I was distracted by a few other issues. I'm multitasking even on a shutdown time. The point I just want to make is, okay, before that, we are organizing a series of webinars. And this is one of the, I would say, the lowest participation, because we didn't do much of the promotion, because it's just one day we got it. There are a few technical glitches, because we are trying to work out different platforms, which one is a better platform. Other day we used this one WebEx, now today using the Zoom. So each one got its own relative freedom and difficulty. But from a teaching point of view, we are trying to work out which one we should use. So this is another issue. So initially we thought we'll do it on WebEx, then there are some registration issue came. Then we canceled, then we move on. So these are a few technicalities. So we have got another 6-7 webinars on different issues are coming up. Also, we have one on a regional farmers consultation, food security and small farmers, what's happening. So this is just working behind the scene. So the point I just wanted to add to the Professor Ipsida is social science is discovering a new dimension. Traditionally, universities were the custodian of ideas. Universities act as a custodian, you develop and you build ideas. So in that context, universities had traditionally the leadership role. The intellectual leadership comes from the universities. The thinking comes from the universities. Or universities are the thinking head of the nation, the country, the community. That particular role was lost over a period of time. And that role was taken over by industries. industries began detecting, telling the universities what to teach, what to think, what is your, the kind of knowledge manufacturing or knowledge production. This all decided by the interest of the industry. But in the COVID pandemic, what we notice is that universities are reasserting universities' role of thinking, intellectual discussions, deliberations. We are capturing that again because industries is completely abandoned the society. Industries abandon not only physical terms, they abandon the moral leadership. And many of the industries, they utilize this opportunity for sabotaging labor laws, basic minimum labor laws. I'm not even asking for a luxury part of the labor law. This is basic survival, food, and how much time you should work, minimum work hours. These are the 8 hours work life that balance. It was achieved maybe probably about several years ago. So we had to rediscover that. So this pandemic is used by the industries to sabotage the basic human rights, basic workers' rights. And also they fail to give the intellectual leadership. Most importantly, they fail to give them the clarity of values. What values should guide us in a crisis situation. And we can see that 140 million migrant workers has to work. And that is seriously a moral crisis of a society. What is a priority? And probably this is an opportunity for university to reassign on 2 areas. One is intellectual leadership. Universities are the thinking organization. The organic nature of the university's association with the communities and coming out solutions. And also providing the clarity of values which should guide us in the time of confusion, in the time of disasters. So I would say these are the 3 major areas universities are rediscovering their role. So you may think that this kind of modern technology we're using for recapturing that space is symptomatic and important steps, and that's why we are committed to take it forward and assert ourselves that universities and particularly social science has to do a great deal about providing leadership. In that context, what you said about public health is most important because public health is nothing other than a social institution. Health is a social institution. And remember, health is outside the hospital. So, so health is not in the hospital. Health is outside the hospital. We also have a school of public health, which I'm heading there. So we are building a public health, focusing on social determinants of health and social health in all policies as a primary focus of a public health program. But this is actually an extension of social science. So I'm just adding to a few suggestions to them. 2 points raised by the key speaker, and I congratulate and I thank you for taking up this responsibility and accepting our invitation with such a short notice. And I thank you and thanks all of you. And one footnote, this program is being recorded. It is on our YouTube. So I will send you the link for everybody, and also we'll try to get it transcribed. So you will have the text part of it for further discussion. And this is also part of our universities at COVID-19 and SDG linkages we're looking at it. So this is the trail of the linkages between various conferences we are organizing. So we hope to come out with an comparative analysis of all the discussions, debate which we're initiating, which we're part of it. And thank you very much.
Thank you, Ipshita, for coming over as our guest speaker and giving us insight about the importance of social sciences, about how it interlinks other disciplines like science and which is very important at the current scenario. For example, right now we do face this problem of COVID-19, but soon we would also be facing the problems of climate change and economic, because all these are adding up. It's like some time ago, I was actually seeing a picture which depicts the waves of this COVID-19 and the climate change and economy coming up. So though it's not like, but then it's more important. It is that at the current time, we actually should look at the social sciences
Thank you. Hi. And please leave your email ID so I can send you the link of the recordings. Thank you.
Thank you
Yeah,
very
thank you very much.
Thank you.
Thank you.
Nina, we'll talk later. I'll call you.
Yes.
You're on WhatsApp, right?
Yeah, yes.
I'll call you.
We have the number. Yeah.
Sure. All right.
I think it's very important. Thank you for this webinar once again. Very important.
Right. Thank you.
Thank you. Thank you very much.
Thank you.